My guest Giselle Sebag is a passionate urbanist with experience in designing and managing multidisciplinary sustainable urban development and health strategies and initiatives. She works in complex international contexts, building strategic cross-sector programs and partnerships to promote healthy, resilient, and inclusive homes, workplaces, public spaces, communities, and cities worldwide. Let's talk with the Executive Director of International Society for Urban Health. Assalamu alaikum and hello everyone. I'm Asban Sari, the founder of the organization Peacemakers Pakistani, and I'm bringing you the stories of placemakers, artists, and professionals from around the globe about how they created an impact and made change happen. You are listening to the Making It Happen show. Thank you for joining in. Enjoy the episode. Hello, Giselle. Thanks for joining me. It's lovely to see you.
Thank you. It's so lovely to see you, and I'm so grateful to you for having me.
Likewise, I'm grateful to having this opportunity of learning from you. Like, I don't know, the moment I learned from Ethan that you are doing great work in the field of mental health and urban health, I was looking forward to our conversation. It has been like it. He introduced me to you last year, and I was looking forward to it. So, where are you today?
I'm in Madrid, Spain. I recently moved from New York to Madrid. I used to live right down the street from Ethan and Fred, actually. So we were neighbors in Brooklyn. We have a great neighborhood, but now we're in Europe, so it's really fun.
Yeah, lovely, awesome. Okay, so shall we start with the questions?
Sure. Yeah.
So tell me, Gazelle, how did you find a passion for urban health and placemaking?
Well, I mean, this started when I was trying to figure out what I was going to do when I was applying to colleges as a teenager. And what happened was I visited this place that we have in the US in Arizona, and it's called Arco Santi, and it was designed as a prototype city by an old Italian architect. He actually recently passed away. His name was Paolo Soleri, and he created this place in the desert that was supposed to prove his concept of something that he called arcology, which was architecture and ecology combined. So the idea was that this started as a passion of mine for finding ways that humans can live respectfully with nature. And this was a really nice example. So there, for example, they used all natural and local materials. They used mud to create structures. They had a community garden where all their food was grown. The water that they used there was filtered by plants, all completely natural. All of the local, flora and fauna, all the animals that were meant to be there were there. The humans were there, and it was beautiful. And I was looking for a career that I was passionate about, first and foremost. I didn't want to go make a bunch of money. I wanted to do something that I cared about and that I thought would be helpful and make a positive impact on the world. And I needed it to work internationally because I have an international family and I grew up traveling a lot. So I thought, we want to make sure this is something you can do anywhere. But so I was thinking from that experience about sort of sustainable architecture, green building. And I took a class when I was still deciding my first year of college. It was called Architecture and Society. And it was about all the different ways that our built environments and sort of the things that architects create around us, how they influence our behavior and our lives. And that's where I thought, like, oh my gosh, this is so important. I never thought of it that way. And I got kind of hooked. But then I went to school for that. I went to school for architecture and focused on sustainability. And then when I started working after school, I was working in a sustainability consultancy on mostly green building projects. And I realized that architecture, sometimes when you look at the building level and scale, you sometimes forget about some of the most important places, which are the spaces in between the buildings. And I realized that sometimes we think that we have, the greenest net zero building in the world. It has, it doesn't use any water. It's completely energy efficient. It has solar panels. But some places that I saw and that I was working on, you drive there. And so it just doesn't make any sense. You just aren't having the positive sustainability impact that you should. So I started thinking about more beyond the building level and thinking more about communities and the spaces in between and the parks and the public spaces. So I got into the sort of neighborhood and city level scale. And at that point, I actually also was invited to it was a conference. It was called Prescription for Healthy Cities. And it was looking at all the different ways urban design, urban planning, the spaces in between, how those are designed. We can make those both sustainable, but also the connection with human health and well-being. So that's kind of where I got hooked in the connection. Eventually, I got frustrated with the slow pace of especially sustainability work happening in the US. And so I went and I studied international cooperation and sustainable urban development and planning in Europe. Actually, I got a nice scholarship, and it was with people from all over the world. We had someone from Pakistan, for example, in my class. So I got to learn from my peers who were doing this type of work globally. And the idea was that we would be thinking about how we can help other places avoid the same. Well, in my mind, it was how we can help other places in the world who are rapidly growing, urbanizing, and developing from avoiding the same mistakes that we made in the US that we know are avoidable. Things like organizing everything around the car, or having big suburbs where there's not connectivity, there's no walkability, you can't get anywhere on foot or by bike. So anyway, I got into sort of that type of work. And it was when I was studying in my master's in Europe that I discovered this idea that cities are actually for people. So why are we making them about cars? And that's where I discovered placemaking and Project for Public Spaces and the amazing work they've been doing. And really also between sort of this connection between making places that people love and also building truly sustainable and healthy communities that everyone can enjoy.
Awesome. So it has been a journey, like where you arrived to this point. So that's why I believe when we are on a journey and we find this answer, we really stick to it. Like it's very hard to deviate from this path now. And I'm glad that we have you on this course. Also, you mentioned that you took a class which was about architecture and its impact on humans. I am really intrigued by it. I would love to have that class as well because I'm an architect, but I really wish that we had such classes for our students. Like as we were in the school or we were in the university, I wish we had this sort of course, and I really wish to have create this sort of course for our students for the future generations. So I would really love to know more about it. You can share with me if you want to later in chat.
Yeah,
sure.
it was the only class I ever took, I have to tell you, that was on that topic. And it was like for everyone, not only architecture students. And then I never got it again. And then after I graduated and was working, I had to like always make the connection with people. And still to this day, I love my architectural colleagues, but I call myself a fallen architect because I'm totally into the people and the communities and the urban planning piece much more now. Because sometimes my architectural colleagues, they forget about the people. It's so frustrating.
Exactly. I think we share this one because I'm really disconnected with the. Sometimes I have to ask myself. I have to ask myself, am I really an architect? Because
I'm not anymore.
I've come so far from that. But I really enjoy doing interior designing and interior styling. I love that part, but not the planning aspect because it has a it is another study on its own, and I enjoy the urban part more. Okay, so tell me, how do you define urban health and its significance?
So, okay, so I was thinking when I was thinking about us talking today, I was thinking about it. And in so many ways, I realized, I mean, I guess I knew this, but that there's a lot of ways that urban health and placemaking are actually similar. So one of the best ways that I've heard to describe placemaking is that it's you can't define it. So somebody else asked one of our placemaking colleagues, Ramon, what is placemaking? How do you define it? What is it? And he said like, oh, that's the great thing about placemaking is you can't define it. It's whatever anybody wants it to be, which is kind of beautiful. And in some ways, urban health, yes, it is more defined than placemaking, but in some ways it also is hard to precisely define, and it seems to encompass all things. So anytime, we can say any aspect about, community development, we can say that's placemaking. And we can also say that's urban health. So I guess that to me, urban health is really thinking about and understanding all the ways that the physical and social environments that we live in, that we work in, that we grow in, that we learn and spend time in. And for most people in the world, right, those places are in towns and cities. So all the different ways that those environments impact our physical, our mental, our social health and well-being. And so we call in the public health world, we call those, determinants of health. And in any urban setting, there are countless determinants of health, and urban health is the only field that is explicitly focused on addressing so the comprehensive determinants of health in cities. And people are truly a city's most important asset. Sometimes we forget that, but I want to remind all of us, people are the reason that cities are great. They're the reason that, any city has a character, that has great buildings, that has great things to do, that has, people to meet, interesting things going on. It even is the only way that the cities are collecting the governments that are there, only because of the people are collecting tax revenue and can do great things. So anyway, people really are the city's most important asset, and protecting and promoting health and well-being of the people that are living in cities should really be of the utmost priority in cities that want to thrive. And because, they only exist because of the people who live there and make them great. And the thing about urban health that is so, I think, inspiring and exciting and significant is that over the so I got into this field, now it's been like, more than 15 years already. But this field has been growing. It was already going when I got into it, when I discovered it. But we've had probably around 20 years of good growth in this field, where it now sort of exists as something, and before it was nascent still. But as it's grown, we've amassed a lot of really good research and scientific evidence around how we can shape communities and neighborhoods and cities to support and promote resident health. And the return on investment in these changes is so significant. It really costs us so little to make these changes that can drastically improve our health and well-being outcomes. And we know, for example, so many ways that we can make a huge and important impact, and what kind of impact that's going to have, especially, I would say, and the way I think about it, is especially in terms of physical activity and healthy diet and nutrition. Those are areas that we can make such a big impact on, and that are really some of the leading risk factors for death and disability today, especially non-communicable diseases.
Yes, and yes, you're truly right about it, because when I started the work, I was very focused on people rather than the city. Like I just like to be representative as a person, not as a profession. For example, I like to be called someone who likes to build or create something for the comfort of people, rather than just someone who is an architect, who likes to
Right.
build.
Yes.
So there's a difference in it. And I really love that if I'm into placemaking, then I'm really for the urban health. That aspect of,
Yes.
I'm not designing the cities, I'm not creating something to look at, I'm creating something to live in, to be enjoyed by people.
Yes.
So that's amazing to know that urban health is my area as well. So it was
Yes,
to ask,
that's my biggest message, actually. Everybody is working in urban health who changes or makes any change or impact on the physical and social environments that we live in. So you, yes, are an urban health worker. You're in charge of public health.
Yeah.
That's like my most important, message that I try to promote when I'm doing any kind of talk with anyone, is that whether we know it or not, all of us are impacting the health of the communities that we live in with the changes that we're making in the physical and physical environment. And so we have to realize that. And it's like a really important, big responsibility that we have. And if we're not considering the impacts that we are having on health and well-being through our design decisions, then we can be, and often, not on purpose, but often we actually are hurting health and well-being. So we really have to recognize what kind of an impact is this decision going to have, and how can we actually make the decision that is going to promote and enhance health and well-being of the people using this space, rather than not consider it, or rather than, in some cases, actually hurt health and well-being of people,
Yeah, exactly.
So it's so important that you recognize that. Yeah.
Thank you so much for helping me recognize that. Okay, so tell me, what are the social determinants of community health?
Yeah, so social determinants of health are the factors in our environments where we are, where we live, and where we work, and where we play, that affect this wide range of health. So and quality of life outcomes and how we function in the world. So, for example, all these aspects. When I say the physical and social environment, this is what I'm talking about. Our housing conditions. What type of housing do we live in? Do we have access to clean water and clean air? Do we have access to, and are we able to have exposure to nature, to green space? Are there places for us to engage in physical activity? Do we have sidewalks to walk on? Do we have safe bicycle lanes that we could actually bike on if we wanted to? Do you have educational opportunities where you live? When you go outside, is there the potential of, meeting violence? Can you go outside safely and spend time outdoors? Can you access nutritious foods? Are there places for your kids to play? Are there places for you to sit with other people and socialize safely, comfortably? Is there a bench? Is there shade? So all of these different aspects are the social determinants of health. And they actually, even though they're called social, they're also encompass the physical aspects. So they make up our social life and our social health, and also our physical health, and also our mental health. So all of these different aspects, they actually play such an important role in determining how healthy we're going to be. Some people don't realize this is, I think, such an interesting consideration. Where you're born in the US, but also in many, many cities around the world, where you're born is the number one most important factor around how long you're going to live. So if you're born in one neighborhood that has all of these health supporting social determinants of health, like access to green space or a sidewalk, or good quality schools or job opportunities or public transportation access, you might live 10 to 20 to even 30 years longer than someone who's born right down the street, but who those different factors in the neighborhood are different, and they do not support health and well-being. And then that actually causes altogether that on average, people live less years, and significantly less years sometimes. So we see this when we look at different cities. We can see that babies that are born right down the street from each other actually have drastically different life expectancies. And that's what we're talking about when we're talking about the social determinants of health. And those are the things that we largely know how to prevent at a low cost. So the good news is that this is totally, totally preventable. These disparities do not have to be this way. And we know that because here in the same city, we have an environment that supports health for a better support and for a much longer time. So we know that we can also create those conditions right down the street if we want to.
Yes, this was a great checklist, and it is something that all the beginners can start with, So this was a great question. I will make a snippet out of it. Okay, so what is the impact of public spaces and urban spaces and our environment on mental health of individuals according to your learning?
So public spaces and our environments have a huge impact on mental health, and it's so important in so many ways. So basically what you get with public spaces and open spaces is you get so many health impacts. So sure, we'll start with mental health, but I also want to talk through some of the others too. So for example, around access to nature and exposure to nature, there's so much literature and data that shows us how important it really is. And for example, when you have exposure to nature, let's say for kids who are going to school in the morning, when they actually see nature, walk through nature, have a little bit of exposure, even if it's just a short amount of time on their way to school, for example, their cognitive learning at school is so much higher and so much better than if they don't have that. So it really affects stress of everyone, especially kids, but also adults so much. If you have access to green space or nature or a public open space where you can have some social interaction, you're going to decrease your stress, decrease your anxiety, improve your mental health outcomes. You often decrease depression. Also sunlight, having exposure to sunlight. So it's a place to be outside in a public open space. If you have some vitamin D, it also helps your depression levels a lot. So does the opportunity for physical activity. So physical activity, we now know that physical activity is better than drugs for curing depression and other mental health ailments. So it's much, much better than that you spend your money and time on just walking to your local public space if you can, or even biking, getting a little bit of physical activity, even walking. That is going to improve your mental health and decrease, depression and stress and anxiety, all these things, so much more than if you take a pill. So it's cost effective. It's good for, everything. But you have to have a place to do that. So, how could you be expected to walk, for example, if you don't have a sidewalk in front of your house, if you're forced to drive? Those are the types of decisions that I mean. We have to build them into the physical environment so that we all have opportunities to make what I call the healthy choice, the easy choice. So if doctors are saying you have to walk more, you need more physical activity, it's going to improve your mental health. It's going to improve, obesity or diabetes outcomes that you might have. You have to have a place where you can actually do that. Otherwise, it's not a choice and it's not behavior. So that's the other thing that bugs me, is that oftentimes people talk about behavioral choices. And the only choice we have are the ones where we have a design opportunity built into our environments to actually take, right? So anyway, so back to the public open space around mental health. So it really improves so much, your stress, your anxiety, your depression, but also your cognitive learning abilities over sort of a lifetime. It also, don't forget that it improves our air pollution levels. So when we have more open spaces, especially when we have nature incorporated into those, we are actually improving the air that we're breathing when we have trees, for example. When we have a lot of benches and places to sit, that also helps with the things that are caused by climate change impacts today that we're dealing with, like heat. So when we have more trees, they can actually shade places to sit and rest, especially for older people. That's so important. But also in terms of our mental health, having a place to meet and gather and have social interaction really makes a big difference on our health, our emotional health, our social health, our mental health, right? So when we have opportunities to meet with people, especially from different age groups, different backgrounds, that is going to really also improve the types of social epidemiology outcomes that we have and social health that we have. So that's also important, especially, older people are often have a big challenge with isolation, and some, especially Western cultures, isolation and loneliness is a huge issue. And we know that the health impacts of those are really terrible, and public open spaces and increasing and supporting opportunities for social cohesion and for social interaction are really good ways that we can combat those as well.
Yes, and I agree with you in this, because this is my findings as well, especially about how the environment is right now and how we are facilitating the changes in the environment and the behavior changes, behavioral changes through the physical environment. That plays a huge role, and this has to be the education part as well for the urban planners, designers, and architects as well. Definitely. Okay, so how does placemaking, urban design, and participatory design helps in improving the urban health for you?
So I think that placemaking to me is one of my favorite tools for really creating community-driven urban change, right? And transforming neighborhoods to support urban health. I really love the focus, the built-in focus that placemaking has, and the approach on the community is the expert. The community is the one who decides what are the challenges that they're facing every day, and how can we come together as a community to decide how we want to change and transform our environment to support better health outcomes for all of us. Only the community themselves are going to understand what their challenges are, who is there, what the needs are, and create the right solutions that we're going to have sustained transformation over time that people are really going to use. So often you see architects, let's say, we'll just blame the architects, but designers coming in, this even happens with landscape architects, for example, now that parks are so sort of hot and there's one style of park. So often people come in with their design idea. And as you said it earlier, I come from a family of artists, so I love art, and I love architecture and design for design and art's sake. But we have to remember that the places that we're building are for people to use, and not just for sort of an iconic architecture type of project that doesn't have anything to do with the places around it or the communities or the contexts that they're in, right? So to me, placemaking is really the way in to understanding a community and to solving and transforming and creating environments that support health that they're going to stick with. So often, like I was starting to say, you see that designers come in and they have an idea that they impose on a community, but then a month later, a year later, a huge investment. For example, I worked on a project, I won't say who, but a big development agency, created new toilets for a school, a girls' school, in Zambia, in Africa. And they only talked to the headmasters, who were men, about what the needs were of the girls for their toilet project. And then they invested millions. And then within like 6 months that weren't being used at all, the investment was totally lost. It was a complete total waste of time, money, and energy. And in fact, in some cases, it was less safe than it was before, because they hadn't thought of the girls' safety when they were considering the design of the toilets and sanitation system. So I just think that placemaking solves all of that for us, because it's driven by the community. The community is the expert. They're the ones telling us what the needs are, how people interact, who it is who's interacting, and how we can really support greater, social interaction, cohesion, and also create public and open spaces that people will use. Participation is so key to a successful urban health initiative. We cannot have, in my mind, we absolutely cannot have a successful transformation or change in a neighborhood or a community or a city that doesn't have, sometimes I have a problem with participation, because it's not that they're participating and then they go away. It's that they're integrated into the process. And that's what placemaking does.
Okay. Yes, I sometimes struggle with the participatory part, because people are not very sure about what they want to do, and they are not very confident in voicing that out. Because I have seen that a lot of people here struggle with their mental health and their emotional maturity. So they are not very sure that their needs are required to be addressed. First of all, they would have expectations that people know. Secondly, they don't know how to communicate their expectations. That's the most struggling part, and that makes me very frustrated at times. So
that's like psychology 101. That's like the base of any relationship problem, is that we don't know how to communicate, and we assume the other person knows what we're thinking. So
Exactly.
it's not just your community. I think that's just humans.
Yeah, that's true. So I had to learn the leadership skills and the communication skills myself, because I won't blame people. I blame myself as well, because I was very poor at it myself. But with learnings and with lessons, I really learned the methods of how to do it. And Brené Brown was very helpful for me in this regard. So yeah, I like to mention that. This is okay. So how diversity in spaces, including human differences and personalities and overall diverseness, can be beneficial for mental health, according to you?
Yeah, well, it's not according to me. This is according to the science. So we have so much research that tells us that the diversity of social relationships that we have are equally important as the quantity of social relationships that we have, especially as we age. So there's a ton of research now backing this up, but I think it's a really interesting area of research, and I've always sort of believed it. So I'm really glad to see that the research is supporting what sort of intuitively I think all of us placemakers and all of the people working in this field, like you and I, already knew, right? Which is that when we meet people with different backgrounds and experiences, we are, our social health, our mental health, our emotional health is supported. And it is bettered. And we do have now the research to show us that, I was mentioning a little bit before, right? Especially when we think about aging and loneliness, this is something that I got really into when I was actually studying international cooperation and urban development when I was in my master's in Europe, which was this idea of time banks. So stick with me, because it sounds like it's a different topic, but it's not. So in the UK, for example, and now in other places around the world too, their health service actually prescribes, especially for older people who are suffering from things like loneliness, they prescribe time banks, or spending time with other people and exchanging not money, but sort of services and time with each other. So there's all these great benefits to that, right? One is that, in fact, when you've retired, for example, you can still get services that you might need without paying money, like a haircut, something like that. But also older people who have all these wonderful, important skills, even though they've retired, they can feel valuable because they're actually offering things to other people. But mostly what it does is it gets people together, especially with different backgrounds and different ages. And the reason that the health service prescribes it is because it decreases the hospitalization rate so much that it's a huge, the return on investment is so huge that just telling people to spend time together from diverse backgrounds or ages and with different experiences, exchanging new ideas, learning new things about each other, or about the world, that increases the longevity that you're going to have, and it decreases, the hospitalizations that you might encounter. So we know in so many ways, anecdotal, but also through evidence, that really creating a diverse places that we can have a diversity of interactions with different types of people is going to have us all live healthier, happier lives. So it's also sort of, reminding us all to try to be open-minded and think about things from other people's perspective, even though I know it seems hard sometimes, because that actually helps keep our mind mentally fit in many ways as well.
Yes, I agree, and it also builds our capacity for tolerance. And there is also a terminology of mental health that's called window of tolerance. It's very important to build our personal capacity to tolerate different emotions and different things and different opinions and our triggers as well. And also, there's there's a great need for the tolerance for other people and their opinions. Because for placemakers, if we are not having this capacity, I don't think so we are able to collaborate with anyone. Because there's a great struggle when we are having different people on board and then doing a project with great fun, because we need to have this skill. So
that's one of the challenges of placemaking, right? Is that it's not top-down driven. So we actually have to be tolerant if we're going to carry out the process the way it was intended, right? Yeah, you're right. Absolutely. It's built in, like it's something that is so important. I'm not saying, we're not all magical, but I think as part of the placemaking process, we have to incorporate that important aspect to our work if we're going to be successful. I completely agree.
Yes, and we learn this skill over the time while we are experiencing it, definitely. Okay, so how will you explain that housing design is the key strategy in combating diseases around the world?
Yeah, so housing design is something that I kind of started in when I was doing green building, right? So the housing piece is actually so critically important to the entire city or community level, and to urban health, of course. But I would, one thing that I think about around explaining, I guess, how housing is important is reminding us all that for COVID. So, okay, I don't know how it was where you were when COVID hit, but in the US, a lot of urbanists, especially, a lot of people who are working in cities and thinking about cities, immediately everybody blamed cities and density for spreading COVID, right? Because we were seeing it in big cities and in big airports and in places with a lot of diverse populations coming from all over the world and globalization and all this. But in fact, what we found out pretty quickly thereafter, much to my relief, or did at all, it was overcrowding. So subpar housing conditions. So when too many people were living in too small of a space together, which we wouldn't recommend from a health perspective, no matter what, that of course was allowing a greater and faster spread of COVID. And similarly, the people who were living in overcrowded housing, oftentimes they didn't have a lot of good labor protections in their jobs or workplaces. So they were actually exposed more to the disease, and then they were bringing it home and, exposing the people in their house. So I just wanted to sort of remember that it's not density that's the problem, but overcrowding is a real problem for all of us, especially when we have something like an infectious disease outbreak, right? But in any case, it's really, it really doesn't help any of us. But we see all over the world how housing can really have a detrimental effect on the people that are living in subpar housing conditions. Now, of course, this is very obvious in informal housing, which not always not at all, but sometimes or oftentimes there is subpar conditions there when we don't have adequate water, clean water available, or sanitation options. When people couldn't wash their hands, sometimes I was working during COVID in a lot of communities that didn't even have sort of access to clean water to wash their hands, much less drink clean water, anything else like that. When we don't have utilities, regularized utilities like electricity, obviously kids can't do their homework. And so many people, especially in the informal sector, have to live and work out of their own home. So I think that's also a huge challenge. When you have a sub-quality housing condition, the job that you're doing, if it's out of your home, that also affects you. One of the projects that we're working on for our Accelerating City Equity program right now is a project in Ahmedabad in India, in an informal slum area, where the climate change has really affected the heat that people are withstanding during the summer. So it's up to 5 or 6 months of more than 40 degrees Celsius, more than 100 degrees Fahrenheit. And women are working out of their homes and they're suffering. Heat is a huge issue, and it's a huge urban health challenge, especially as climate change continues to make it rise. So, things like that, we need to, decrease the temperatures inside the home so that people can live safely. But that's not only a problem in informal slum areas. That's also a problem in, high income countries like the United States. All over the United States, we see the same challenges with housing. We see problems like in energy inefficiency or heating, that are really affecting people's health and well-being, especially older people and especially kids. We also have challenges with people being able to afford their utility bills. So even in places like the United States, where we have a lot of air conditioning, which is not, environmentally friendly, that's also worse for the climate, but we do often have it available. But many times people who are in lower income settings or situations, they can't even afford to pay the air conditioning. So they go without, it's too hot, etc. There's also so many diseases that we can see that could be avoided with better housing conditions. So really, it's so key in every single way. Infectious disease, non-infectious disease, heat, sanitation is a huge issue, especially there's parts of the world where, so a huge percentages of children are dying from completely preventable waterborne illnesses. In India, for example, that is still the case. Probably in Pakistan, that's also a big challenge as well. All these issues could be solved with housing. So yes, it's such a key piece of the puzzle, and probably sort of the baseline for any healthy communities, that we have adequate housing where people are not overcrowded and where diseases don't spread, and where we can have a manageable thermal comfort level. So many different areas. And we work with a really wonderful organization very closely named Archive Global. If you don't know them, it would be great to learn a little bit about them. Because they are actively working on architecture for health. And so when we work on a housing project, we call on them to help us to actually implement, because they implement all over the world.
Great. Yes, I'll look into it. And we have worked on this project as well, about the housing project for the sustainability. And there were a few points that I learned myself too, which is one was the choice of materials. Like local materials are more supportive, and of course the openings and how we are managing it, and how the ventilation is being done.
Yeah. What was the second thing you said?
Ventilation, and one is how the planning is done. The local materials have to be used, and then thirdly, there will be the social connection of spaces, like how we are opening the spaces into the living room, like where people come together and they desire to be together. The isolation and the room part, staying inside the room, this is not to be encouraged. And fourth one was the excess of sunlight, the exposure to sunlight within the houses. That's very important. So these few points were also very important for us to study to incorporate while we were creating homes for the sustainability aspect.
Absolutely. And just to say, I could not agree with you more. And that's kind of how I got into this work, was around, the vernacular architecture and sort of the green building aspects that also support health in housing and in buildings. Just to say that, the traditional, as you said, the materials that are local and the traditional materials, they are local because they worked for thousands of years in many cases, without air conditioning, without electricity. They've worked for that geography, for that climate. So to me, the answer is always in the local materials, and they're just such brilliant solutions all over the world. I know in Pakistan, they have amazing local architectural styles that work so well for that climate. My father's from Morocco. In Morocco, they also use sort of mud, and they make very, very narrow streets, which allows the wind to come through and to cool things naturally, as well as having the courtyards with the fountain in the middle, which I think
Exactly.
probably in Pakistan you have that too. Yeah.
Yeah,
I
yeah.
mean, that genius. So we just have to look back. It's not even that long ago. It's like 50 years ago, before there was air conditioning and before every single place around the world was trying to be the same as Houston, Texas. It makes no sense. You have to think about, where is the actual geography that you live in? How can we, and this is such a placemaking mentality as well, we have to think about the importance of place. We can't forget that. And there we have, I think, the key, all the local materials, as you say, so important. Ventilation is so, so key. We also saw that with COVID. The most important thing to me with COVID prevention is ventilation. And
Yeah.
it took like more than a year for even like WHO, and I love WHO, but they were slow. They didn't think about ventilation until the end. They didn't even acknowledge that COVID was airborne until the end. And we architects that were working in this, we all knew that since the beginning. You have to think about ventilation, right? Just
Yeah.
open a window, it'll go so far. So those are such important aspects. I completely agree. And I love also that you're talking about sort of the way that the social spaces are organized. But to me, that has so much to do with the placemaking process and with participation, because I see in different places around the world, the way that people socialize within their homes is completely different. And that's where you see problems when people come in with one solution and they say, this is how the social spaces should be organized. But every community, every culture, I would say, even within the same countries, even probably within the same cities, they have different ways of interacting. And we have to keep that in mind and make sure that they're the ones driving, I think, how the design is for the housing to be supportive of everyone. But yes, I mean, we don't want so much overcrowding that nobody has their own space, but at the same time, we need to have social space. I think often we see historically that's around the kitchen.
Yeah, definitely. I agree that different families have different lifestyle and different behaviors of how they live and how
Yeah.
they lead their families. And yes, lastly, I would like to add that to me personally, local materials and the traditional style of buildings inspire me. It makes me feel at home. It makes me feel like I'm connected to my ancestors. There's
Yeah.
I don't feel isolated. Even if I'm alone, I don't feel alone in those areas when I go to the old spaces, old housing. So I think there is that connection as well, which is good for our mental health, I guess so. Just
Yeah, of
right.
course. I mean, feeling comfortable, I guess, with the environment that you're in, that I think does go a long way. I think that's really, yeah, that's really interesting.
Yeah. Okay, so you have worked in different areas in different countries, or so is there anything that you would like to share, few words or experience that were inspiring to you?
So many things, so many things have inspired me over the years. I don't know if there's one thing I can point to. But I am truly like, such a placemaker at heart, I guess. I mean, I'm like, I drank the Kool-Aid. I'm like a total groupie. I find so much of the approach and what is out there and what we are sort of also growing as a global community around placemaking. To me, that is so inspiring to meet people like you in Pakistan who are thinking about driving, community change and transformation in your context, the same way that we're thinking about it around the world. But local, but with that connection to place. To me, it is just so exciting and inspiring that there is a global movement of placemakers around the world and that we can connect. And to me, actually, every time I meet someone who's into this placemaking, team placemaking, it's like a family. I don't have to know you. I mean, like, right? Somebody in the placemaking world connected us, and all of a sudden, I know that we're going to get along. I know that we have similar interests, similar objectives and goals, and that we're thinking about things the same way, and that you can be working, in Pakistan on driving that forward, and I can be working in any other place in the world, but we have the same goals and are aligned. So to me, it's such a inspiring way to just think about making I mean, at the end of the day, like we said, it's about people and it's about making great places that we love and that we can come together and interact with each other more. How can that be bad? Like, actually, I mean, I laugh, but it's so true. Like, Fred is so inspiring when he talks about placemaking being, a solution for so many of the world's great challenges. But it kind of is, because it's a way of getting people together, thinking in the same way, but recognizing the importance that each specific place and community has. Actually, I wasn't going to say this because but actually, I think Ethan brought something up to me when we were together last fall about this. And one way he put it was that what's so wonderful about placemaking is that you don't actually have to agree with your neighbors to get together with them and to agree on how to make a great place that you can share. Like, you don't have to agree with their politics. You don't have to have the same opinions about the world. You can, in the US, we're very, very divided today. And I know that that's a trend around the world, is that places are becoming more and more polarized with each other. But you and your neighbors might be polar opposites in terms of the way you're thinking, in terms of voting or your politics, or even your beliefs. But you're neighbors and you have to share space. And placemaking allows you to get together and to somehow still work together and interact in around creating a community that you have to share with each other, whether you like it or not, without having to agree on all of the other pieces in the world that are so dividing, So to me, it's actually a way of bringing everyone together. I love it so much because I do think it affects and has an impact on all the different, all the important, we have the placemaking transformative agendas, and health is only one of those, right? But it really does get at all these other things. It improves sustainability and economy and health and so many other things. So I really do kind of think that it's a transformative way of getting at people together to think about how they want to live in community next to each other. I do have a quote from Fred that I love so much. I have so many quotes from Fred that I love so much. So it was like really hard to choose. This isn't the only one, but one that I love, you've probably heard it, is, if planning is composition and architecture is frozen music, placemaking is improvisational street performance. So, it really has this human, messy aspect that we have to embrace, but it's not like so strict and rigid that we can't, that it's one way that's imposed on you. We have to get together and talk to each other to make great places happen. So, yeah. And I really do think that it's sort of a great way of getting at and supporting this holistic approach to urban health. So that's the connection that I want to make as well, is that if we connect with one another, with our neighbors, and make great places that we love and that we share, we are implicitly going to be improving collectively the health and well-being outcomes of every single person that is enjoying and sharing that space together, because we're going to be thinking about the needs of the youngest children and the oldest people at the same time.
Yeah, great. And when you mentioned that you love the aspect of our community of placemakers, and we don't need to know each other, our backgrounds still, but we connect together because of our mission or of our vision towards life and towards places. I recall that how I was happy to see people in India connecting people around the globe that came to India. I wasn't there myself, but I was feeling that I am there. I was so happy to see the community together. So it was such a human connection, and it was lovely to see that happen. And I'm very honored and very happy to be a part of this community. Okay,
I
so
agree. I have to say that I feel so privileged to have found this community and this family,
definitely.
Which allows me to meet you. I'm going to Nepal next week. I'm going to meet the person leading placemaking Nepal. She's amazing.
Yeah.
And then I'm going to India and I'm going to meet the people who are working on placemaking in India. And I already know that they're incredible people doing incredible things. And it feels like you have a whole global community. And I have to say, placemaking, I have to give, Placemaking X and Ethan and Fred and the founders of Placemaking X a lot of credit, because it wasn't always this global.
Exactly.
I was working with them in New York when we were making it global. We were talking about making it global, but look what they've done. There's a community of people all over already. And I just feel so privileged to have found it and to be a part of it.
Definitely. Yes. I was appalled by, I was just awe by this, that I'm connected to the people I was just starting up, but then the connection was very encouraging to me. Like I felt that yes, this is the right thing to do, and the constant encouragement is very helpful in this part. Okay, so you are executive director of International Society of Urban Health, and I have learned a lot from you, and I hope that audience have learned a lot from you and your work you are doing. So I want to ask you this question: that is there any favorite project of yours that was very inspiring and encouraging to you while you were working on it? Any moment or anything that you would like to share?
I mean, thank you for the question and thank you for having me. I hope people have gotten excited about urban health and the possibility of incorporating urban health into their work, doing placemaking work, urban design work, urban planning, architecture all over the world. I can't say that there's one project that has inspired me more than another, but I will say that sort of the collective approach that we have been talking about to me is so inspiring, that in community after community that I've worked in around the world, it doesn't matter the city, the country, the region, the continent, I've seen in every place how people in their community care about their community, and they come together and they want to transform and improve the lives of their neighbor, themselves and their neighbors together collectively. And it's such an inspiring way. So I have this amazing project that I worked on with my wonderful colleague that I still work with today in Bogota, where we transformed a sort of a vulnerable and quite poor community, where the early childhood development rates were really lagging behind the rest of the city. We transformed it to try to support health and well-being and the development of early childhood specifically, so kids age 0 to 3, because that's the most critical period of development. And we did so many. We took a placemaking approach by letting the community drive everything, but we did so many physical and social changes that allowed a completely different way of life to be. So the kids, it was so violent. There was so much gun violence. When kids went out of the house, the parents were afraid and they kept their kids inside. So nowadays, the kids can use the public spaces. We have new green spaces. We have a new community garden. They're learning about sustainability, organic foods, healthy foods, even waste. There were not really like trash wasn't something that was considered before. It was sort of the public and common space wasn't respected. So people just threw their trash wherever. Now we have trash receptacles, and people are actually putting it in there so that we can have a clean social and public space that people share. There's sort of new routes where people can walk safely to school with their kids. There's safe crosswalks. There's pop-up play areas. There's playgrounds designed specifically for the needs of young children. And then for the caregivers too. So caregivers were isolated because they were never outside and they couldn't interact. So we also have benches in the parks so that the caregivers can also meet each other and spend time together, which is equally important, I would say, as the kids getting to play outside and have some physical activity. That's a really inspiring project to me. It was multidisciplinary, as it should be, and multi-sectoral. We were working with all different parts of the government, with NGOs. I, at the time, was consulting from another outside entity on how we were going to design this. That was really amazing. But there are projects like that all over that we're working on. In 2 weeks, I'm going to Ahmedabad to visit an organization, the Mahila Housing Trust, that I've worked with for actually many, many years now, because I used to work with them in my old job, where we launched together a commitment, a project that we called a commitment to action, that was around making Ahmedabad open defecation free. And it was about improving sanitation and sort of the toilet infrastructure that existed, but it was also around training young women and adolescents to, get together and to feel empowered about what they can do in their community. It was about menstrual hygiene management and education, about safety. We added lighting, for example, et cetera. So it was about so much more than just, it was also mapping of the community that was largely ignored. It's about so much more than that. And now I'm going back to meet them, to meet some of the women and some of the people that they work with, focused on another project, which was around cool roofs for women who are living in these largely informal, sometimes inadequate housing conditions in Ahmedabad, but who work out of their homes. And because of climate change, the temperature now reaches above 40 degrees for many, many months on end. And they developed, the Mahila worked with them to develop a cool roofing strategy, sort of like a reflective roof, but a little bit more advanced. So the temperature can come down enough where they can actually spend time within the homes working, but also their kids can do homework safely, et cetera. So I could go on and on and on. There's so many inspiring projects to me, but I guess a message that I actually want to say to you today is that, and this is something we're working on for a larger project at the International Society for Urban Health called Accelerating City Equity. But the message is that we can learn from so many of these examples around the globe in all different communities. And it doesn't matter the community, it doesn't matter the place. It doesn't matter if it's women living in a slum in India, or if it's, people living in Los Angeles in the United States. We actually all have the thing that the sort of the human experience is that we all face the same, especially what we call health equity challenges in our day-to-day life. And therefore, the solutions and the approaches that can improve health for all of us, they are the same and they are transferable around the world. So every time I go to a community meeting, somebody will stand up and say, but we're not New York, we're not London, we can't do the same things as those places. You don't understand, we're so corrupt, it's so different here. But my lesson in this work is that actually it is transferable. We can all learn from each other, and there's a lot to learn out there from taking a community-driven approach like placemaking encourages us to do.
Great lessons, great project, and I would love to see if there's any case study of it on the website. I would love to see that. And yes, the message is great, and I feel like I'm a part of this society now. Because,
you are.
Yeah.
You are. And that's actually our goal so we have a new strategic approach, which is we've largely built the field of urban health, and we have the evidence and we have the research. But now I'm hyper focused on getting people like you who are trained similarly to me, who are in the planning, architectural, built environment fields that are making decisions every single day that impact our physical and social environments, because you guys are health workers, right? Those decisions impact health more than anything, more than the decisions that people in the health sectors make. Nothing compares to what the decisions that people in the built environment sectors are making. So we need to arm them with the evidence that we have around how to make decisions that improve health and well-being. So that's our main goal, is to bring more people into our community like you. You are definitely part of our community. You are definitely an urban health worker, community member, family member. Yes. So we really look forward to working with you and exchanging ideas and lessons. And we are actually developing a lot of educational training for architects and urban planners and community development advocates all over the world to incorporate health into their work. So let's stay tuned for that and be in touch about it, because there's so much great work you can do in your community thinking about that.
Great, excited for that. Okay, so these were the questions that were exclusively for you. Now we are moving towards the rapid fire question that I ask everyone to know more about them and just to have some sort of motivation, encouragement for us. Okay, so what drives you, what keeps you focused?
Well, I'm very, very driven by the idea that we have an opportunity to improve health and well-being of people who are living in cities around the world. So the reason I focus on cities and the reason I focus on public health and specifically on the ways that our urban environments can support and improve health is because, as you know, more people today are living in cities than anywhere else in the world, and urbanization is going to continue to grow. So we know that if we focus on people living in cities, I'm going to have a possible positive impact on as many people as possible, but on the majority of humans in the world. And if I focus on the ways that cities can actually impact health, then a lot of times I'm thinking about those the ways that we can reduce the risk factors for non-communicable diseases like cancer, hypertension, diabetes, that today are the leading drivers of death and disability around the world, and that as urbanization continues, will continue to impact more and more people. So what really drives me is the opportunity to have a positive impact on people's health and well-being. And again, we know how to do that. That's the good news. It's not a mystery. We just have to arm the people like you who are making the decisions that impact people's lives every single day in communities. We have to arm them with the evidence that we have around how to support health and well-being in the best possible way through design and through transformative change. And we know that there's an opportunity now because places are urbanizing, and they do not all have to be Houston, Texas. We do not have to orient everything around the car. We do not have to have the same type of buildings and skyscrapers as everywhere in the world. It doesn't have to be globalized. We should have a sense of place about, in every single different community around the world. There has to be a sense of place, and we have to incorporate that. So I'm really passionate about it because I know we can do it, and it's cheap. It doesn't cost any extra money. It just takes talking to people like you.
Best. Okay, so any moment that made you feel proud of your work?
I guess it's just meeting people like you who say like, "Oh, I'm a health worker. I get it now." I feel like all we have to do is just connect the dots and have people realize that the decisions that they make, especially design decisions that impact our physical and social environments, have an impact on health, and just consider the health implications. So that's actually what I'm most proud of, is just that people sort of are thinking about and understanding that they have a big impact on health and they're considering it in their decisions. I feel really proud of that.
Great.
It's, sometimes it's hard because it's hard to see on the ground, but I know because people tell me that they're thinking about health. So I know that then somehow it has an impact.
Great, it does, it does. Okay, so any memory or any moment that was the most struggling part of your work life?
That's a very good question. I mean, I do think that it is, I guess, to sort of keep on what we were just discussing. Sometimes it's hard to work in a field where I chose, and this is something that when people are thinking about what they want to do, I often talk to them about this, because at some point you have to choose what type of impact you want to have. And for a lot of people who want to have impact through their work, they want to and they need to be able to see the impact that they're having. And oftentimes that means that you're working at a smaller scale. And that's such important work, that you really get to know the community, you see the impacts of what you do. But I am focused on having the greatest possible impact on as many people as possible, which means, and this is something that we see in public health, right, is that instead of practicing medicine where I am healing a sick person once they become ill, I'm healing them and I can see the impact of my work, on an individual. But then you put them back out into the world that make them sick in the first place. So to me, because I have this public health approach and I'm focused on having the greatest possible impact that I can, I am thinking about what are the ways that I can prevent people from getting sick in the first place upstream. But that means that I don't get to see the impact of my work. So like we were just saying, I have to believe that this work is having an impact on people in the way that we want. I have to believe that getting the evidence out there, talking about connecting with people who are making design decisions in their communities, and showing them the ways that they can have a greater impact on health and well-being of the people living in their communities, that is actually creating change that I can't see, but that exists. So I think that is a challenge. You want to know that you're spending your time doing something that matters. And so I think it does, but sometimes it is hard to see that.
Yeah, and that's very generous of you. That's very kind of you for still doing it, for still making it happen even for the future generations if you're doing so. Okay, so what is your favorite placemaking mantra or any mantra that works for you best?
The community is the expert. I mean, there's no question. So, the community drives the decisions that are made. They know best what we need, what the challenges are, and what the approaches and strategies should be. So the community drives the process and we are there to facilitate. But they are the ones who are making the decision. So, again, it's not participation to have a meeting and check it off your box. It is that the community, in other places, it's referred to as community-driven development. And that's something that's so important. And I love that is sort of inherent to placemaking. And the other, of course, is that places are for people.
Great. Okay, do you have any opinion for Pakistan or placemaking in Pakistan?
Well, I mean, I know that in Pakistan, there are many of the similar challenges that we see around the world. But there are great communities of people, and I know you're working with them to connect them and to think about how to make more open spaces. So I would say, just, based on my limited knowledge, and it would depend on the context, obviously, but a lot of big, very dense cities, I believe in density 100%. I'm a total urbanist, but we need open and public spaces that we can meet each other and we can connect. And my sense is that in Pakistan, sometimes for social reasons or political reasons or otherwise, there are maybe not as many opportunities to connect and interact with each other as we might hope. So I would really hope to work with you actually to think about ways that we can incorporate more opportunities for social interaction, among neighbors and among community members or residents in similar cities or neighborhoods through placemaking.
Yeah, there are, by the way, thank you so much for sharing that. And thank you so much for being up for making change happen and for helping me. And the thing is that we do have social connections over here, but I would really wish to have more safe connections, in a more safe manner. we are lacking safety over here a lot. And that's
Yeah,
why
safety is such a huge piece of urban health, of course, as well. Yeah.
connections are getting minimized by that. Okay, and lastly, do you have any advice to share for the professionals joining in?
Well, we need you. This is important work, and we need more people to be doing this work. And I think that if we think about placemaking and the approach and the results that it brings, it is the exact right way to drive the greatest possible change that we can have in communities in terms of all the things we've talked about today, including sustainability, the environmental sustainability, but also sustaining the progress that we make over time, and then also in terms of improving health. So we really need everybody who is making any kind of decision in our environments to be considering their approach, making sure that the community is driving what's happening, and also making sure that we are considering the health and well-being implications of every design decision that we make.
Awesome. Thank you so much, Giselle. It was lovely talking to you. I am so happy and I'm so encouraged by your by your answers, by the conversation, because I really wanted to be a part of greater things around health and around benefiting people. Not only people, also myself. I really wanted to be a human being with a good health who is beneficial for others, because if we are not good in our health, we are going to create chaos for others. I do believe that. So yes, for being beneficial, we need to have a good health for ourselves and the community. Thank you so much. It was great talking to you, and I hope that we stay in touch and we have a long way to go together.
Yes, I am so excited to speak with you and to continue the conversation, and can't wait to work with you more. And absolutely, you are integral to creating greater health for yourself and for your community. So I really look forward to us working together on that.
Likewise. Thank you so much. Take care and we'll catch up soon. Bye-bye.
Yes, thank you. Bye.